Each year, 1 in 5 U.S. adults experience mental illness, and 17% of youth ages 6 to 17 experience a mental health disorder.
I joined NAMI because I have 2 sons that live with a mental illness, and I didn't want any other families to feel alone like I did.
At NAMI, the first thing we want anyone to know is you are not alone in your mental health journey.
I just really want to talk about so people know that you don't have to go through it alone.
NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, dedicated to building better lives for the millions of Americans affected by mental illness. We started as 2 moms, gathered around a kitchen table in 1979. And today, we are an alliance of more than 600 local affiliates and 48 state organizations who work in your community to raise awareness, build advocacy, and provide support and education. NAMI envisions a world where all people affected by mental illness live healthy, fulfilling lives supported by a community that cares. Every year we are expanding, no matter race, religion, age, or sexual identity. We are people with lived experience, families and loved ones, survivors and advocates, and together, we will fight the stigma surrounding mental health and create a better world for the sake of all of us. We have resources for you and can't wait to become an extension of your family. We are here for a healthier world. We are here for better mental health. We are here for each other. Join us.
Hello again. My name is John Pulaski, and I am the host for these NAMI programs that we do. And as you've seen, we have a brief introduction that we shared with you about what NAMI is as far as the mental illness concerns that we have in this country and this state. Well, today I'm excited because we have a fellow that is working with what is called crisis intervention, and he's with the Yellowstone County Sheriff's Office. His name is Adam Lauwers, and Adam, thank you for coming.
Thank you for having me.
Adam is also a member of the board of NAMI here in Billings, so he's pretty knowledgeable as far as the background of this stuff. But it's kind of interesting. We had a little bite to eat before we came here, and I want to extend holiday wishes for everybody. We're in that time of the year as well. That the COVID thing really seemed to get in the way of a lot of what you have to do with crisis intervention and just kind of the mental situation for the society out there. So if we can start by give us a definition of what this crisis intervention group is that you're part of, who all is involved in it, and then we'll dig in a little deeper.
So crisis intervention is a team effort that we have here in Yellowstone County. It's comprised of the Yellowstone County Sheriff's Office, Billings Police Department, probation and parole. We work with the Community Crisis Center, the Mental Health Center, and of course Billings Clinic to provide some services for people in a mental health crisis. Our team meets once a month, and we kind of discuss how we can better accommodate that population in our public. And twice a year we conduct a training with mostly law enforcement, but we do bring in other members of the community, and that's a 40-hour training that we do. It's a pretty intensive training. There's some computer modules to that training that the students go through. In those modules, they learn some brief descriptions of mental health diagnoses, some of the things that go along with that mental health diagnosis. They also learn some prescriptions and medications that one would commonly take if they were diagnosed with a mental health diagnosis. And then we teach a lot of open communication, active listening, just a better way of interacting with someone that's in a mental health crisis so that we can help to de-escalate that situation and get them help and get them further upstream in their recovery process.
Great.
So.
Now, let's define kind of this crisis situation for your capacity as a deputy sheriff.
So those crises could be anything from, basically a mental health crisis. The way we we try to approach the situation is it's anything outside of someone's normal coping skills. So it could be as simple as someone getting into a traffic accident on the slick roads, and that being the devastating part of their day. Now they have to come up with a way to get their vehicle moved. They have to get that vehicle fixed and repaired. They're now going to be late for work. Just all of those things that you didn't wake up that morning and prepare mentally to have that happen. And that could send you down a path where you just don't have the coping skills at the time for that. And that's where our open and active listening skills would kick in, and we can help you to work through that situation and get yourself on about your day.
Great. Let's back up. When you talk about training for people, are they like volunteers, or are they paid staff that work with this team?
So generally, like I said, it's law enforcement. So we get all of our officers, Billings PD and Yellowstone County and Probation and Parole brings their officers through the training. Then we've had people from Rimrock Foundation who are part of the mobile crisis response team. They come through that training to get those skills. We've had doctors from Billings Clinic Emergency Department come through. We've put on classes for library aides or anybody in the community really to get a brief idea of what could help de-escalate any of those situations, especially for when you call emergency responders. Sometimes you can set that scene up for us to make it a much easier and less traumatic transition into getting them care, help, or providing them with a resource to get them on about their day.
Super. How pervasive is the problem that we have in Yellowstone County, as an example?
I would say that on average, every officer deals with at least a mental health crisis throughout their shift, with someone in a mental health crisis throughout their shift.
Wow.
Since COVID, that has gotten drastically more common, that we're dealing with people that are having a mental health crisis. I think the uncertainty of COVID sure took a hit on everyone's mental health. We've all grown in a community where we were free and roamed and did stuff, and then COVID came and kind of took those freedoms away a little bit and required us to shift gears and change our way of life a little bit. So I think that affected a lot of people's mental health. It alienated some people further than they may have been alienated. So I think it had a huge effect on where we are as a society in our mental health.
Now, if somebody wants more information about what you do and who all is involved, would it just be good to contact the Sheriff's Department or Police Department? Yep,
you could definitely contact the Sheriff's Department or the Police Department and ask them anything about CIT or CIT training. You can also go on the web. There's CIT Montana. If you search that is our larger parent organization. Through CIT Montana, we have about 6 different academies or regional areas that cover the state of Montana and continue the training for our officers all through the state of Montana. So there would be some information on there.
Okay. Now, you named some of them, like Kalispell,
Missoula, Lewis and Clark County, Gallatin County all have teams in our state. So. Mm-hmm. And I'm sure I missed 1 or 2. No. So
that's all right.
I apologize to those teams.
And you're talking about trying to expand into eastern Montana as well?
Yeah, definitely. CIT Montana would like to get into eastern Montana and help facilitate CIT teams in the more eastern part and more rural areas of Montana. So, yeah.
Referrals come from, as far as people that you go and respond to, where does that come from?
Most of our calls for mental health come through dispatch. Now, Rimrock Foundation would get referrals different ways, and they have a mobile crisis response unit that goes out and takes care of different things. They help provide medications and make sure people are making it to appointments, and they help facilitate people getting what they need a little bit more than what we're doing, because we're a lot of times responding right to the situation as it's going on, and Rimrock's mobile crisis unit kind of continues that path with people.
Okay, so it isn't necessarily that they're lawbreakers.
No, not at all. A lot of times, it's like I said, it's just people that have reached their normal coping skills and just need a little help talking themselves through it, or figuring out what kind of a resource might help them, so that that thing that is the major problem for them right now can become a smaller problem, and they can continue about their normal way of life, if you would say normal way of life for anyone.
Sure.
So,
how long has this group been together, or how long has it been in existence in Montana?
so CIT Montana probably goes back 10 to 12 years. We had a core group of individuals travel to Memphis and learn from the Memphis model, which is what we try to follow here in Montana. They brought it back, and then those teams have just sort of flourished and grown larger and larger. I've been a member of the CIT team for approximately 8 years now, so for at least 8 years we've had a pretty good time going with CIT.
Okay, now when you talk about modeling after something, what are some of the components of what you do that you're trained for?
So the model, the Memphis model, it latches on to more of the active listening. We're not trying to solve the problem, because we can't solve the problem. We're mostly just trying to allow you to talk through what's going on, so that you can identify a new way of maybe dealing with a situation you might come across, so that it is not outside of your normal coping skills, and you can get back to your normal, I guess. So.
And then, if need be, you can make referrals to medical facilities or whatever to help beyond that?
Yes, we would. I mean, we could definitely make referrals to those places. Generally, what we would like to do is help you or help that individual identify those resources and give them the information, so that they could get in touch with them on their own. We don't want to be seen as forcing anybody to go do anything, or directing them to go do anything. So we would provide them the information so that they could further assist themselves.
Sure.
So,
where do you see the biggest component of the population having the most problems, I guess is what I would say?
right now, I think we're seeing an uptick in juvenile in the juvenile area, where kids now are having more mental health issues, and we're trying to help them out in those areas. It's probably till 30s, from anywhere from 10 to 30 years old is probably our area that we're working in the most.
And then elderly, is there a component there that you find you have to deal with frequently?
There is definitely an element sometimes in the elderly. Dementia kicks into this, and that's definitely something that is very hard to deal with or help out with. So that is one area that we work on also in the 40 hours of training, is Alzheimer's, dementia. We do a lot with PTSD also in our 40-hour class, as those are more of the more prevalent areas of mental health crisis that you get called to for law enforcement. So.
Now, PTSD, can you define that a little bit more?
It'd be post-traumatic stress syndrome is what, or disorder is what the acronym for it is. Mm-hmm. So you had a major incident in your life occur that affects you and can send you into, you're not a normal state for you. It can make you somewhat different and not be able to react to your environment correctly, and coping skills. Correct.
So it's not necessarily a physical thing, but more mental?
Right. It would be a mental health diagnosis. Yeah, there can definitely be a physical component to PTSD. but it affects you mentally, yes.
Okay. How does your Yellowstone County Sheriff's Department deal with a lot of this? Is it a separate function that you do, or do you mold it in with the rest of the?
It's molded right into our patrol division. So a lot of the officers that officers and deputies that you come in contact with are going to possibly be CIT trained or are CIT trained. Definitely, if someone calls dispatch or 911, they can request a CIT trained officer to come respond to a situation. But that we're just integrated into the normal everyday patrol. So.
Can you give me some personal examples of interactions that you've had with folks and how your coping skills come into play there?
We have a lot of times where, you're just trying to let someone voice what is going on and what's bothering them. Nobody else is listening. Nobody will hear them out. So if you sit with someone for a little bit and just hear them out, a lot of times you get their story and you get them to speak with you, and you can help them down a path. You may have an experience that somewhat is close to theirs and can provide a resource that you may have done or that you've seen other people do that can help with that situation. So,
give me an example of how you interact with some of the other agencies, like you talked about mental health and Rimrock and some of those. How does that work, or how do you work that?
So, like I said, we have our team here has a meeting once a month. We go over kind of what we're trying to do as a team to help people through their mental health crises. And that, like I said, that team is consisted of members from Rimrock, the Crisis Center, and we talk about people that may have been in and out of those situations and what may have helped, or a new resource that Rimrock has added that might not have been put out mainstream quite yet, or that the Crisis Center has, that we can now pass on to officers and deputies and explain to them that this is a resource you could take someone to or help them get by calling this. This is a service that the Crisis Center provides or that Rimrock provides to assist people in maintaining their mental health well-being.
How do you think this is being accepted by society as a whole?
I think it gets a really good reception. One of the best things about it is that some of the people that we deal with are repeat customers, if you will, or repeat clients, whatever you want to name them. We deal with people, the same people, sometimes on a more regular basis, and with CIT that builds a level of rapport and understanding that has made those interactions more amenable to both the deputies, officers, and the individual we're making contact with. And sometimes can just be as easy as, hey, let's go get you some help again. And they're like, oh yeah, you guys took care of me last time. And they jump in and take a ride with us, and we can go down and get them whatever services or help they need at the time.
Wow. Great. Bless your heart for what you do. That's a good service out there. I'm just going to check my notes here again to see if there's anything that we had talked about that maybe where the training courses are located in Montana.
So, like I said, we do 2 here in Yellowstone County a year. One falls in September, and one is getting ready to happen here again, and it'll be at the end of January, beginning of February. And we do those in the community at a location that we can find that would be suitable to our needs for that time. So wherever we can find a kind of a conference room that would allow for our students to come in and do that training.
Great. Now, you talk about your students. Give me an example of who they are and where do they come from?
So the students would be mostly law enforcement. It's a more law enforcement driven training, but like I said, we do have counselors come in, private practice counselors come in. like I said, we've had doctors from the ER, and Rimrock comes through with their mobile response team and goes through the training. City code enforcement has come through our class to try and get everybody a little bit more on the same page of how you can be open and in your communication style to allow someone to speak with you more freely and such.
Okay, so if just a person, a volunteer in the community wanted to be involved with this team, how can they do that?
So for them to be involved in the team, they could give Yellowstone County or Billings Police Department a call, and we could get them set up with one of maybe our community classes that we've put on before. We could get a class put on that would be a little bit shorter than our 40-hour class, but some general active listening skills, making sure that you're listening to what people are saying instead of trying to think of the next thing you're gonna say when you're talking to someone.
So the listening is a big part of it, isn't it?
Definitely,
Yeah,
yes.
along that.
Yeah.
Okay, great. Well, anything else that you would like to share with the community on what you do and how you do it? Let's talk a little bit about you. How'd you get involved in this? You're a Billings boy. I found that out. Give us a little bit of background on how you wound up doing what you're doing.
So yeah, I was born and raised in Billings. I went away right out of high school to the military. I was one of those people that thought maybe I can find something better than Billings, Montana, and quickly went away and realized that Billings, Montana is a pretty great place. So I returned back to Billings, Montana here, and then got involved with the sheriff's office. I first started out working down at the jail, and that's when I really started to see the mental health issues that come into our criminal justice system, and how that can be a very affecting to people going through the criminal justice system. Stayed down there for about 8 years, and then I got out onto patrol, and right as I got out onto patrol is when I jumped in on the CIT team and started really hunkering down and getting more involved with the CIT team and making it a little bit more than it was. So.
Mm-hmm. Went to school where?
I went to. I'm a West High graduate, so here in Billings. No college for me. I took the military route and thought that was good.
Good
so,
for you. Thank
yeah,
you.
so.
Appreciate your service that way.
Thank you.
Now, what do you see in the future? This COVID thing still kind of comes and goes and relaxes and whatever, but do you have any crystal ball thing that we can look at and see maybe what's coming in the future?
No, I think we as a society are doing really well at lessening the stigma to mental health and becoming more a society that we talk about things and we discuss things and we reach out for help. So I think if as long as we continue on that path, I think things get better or for everyone. So, but I see society is getting onto a page of we all need help sometimes.
Yeah.
So.
Well, that's one of those hard things to admit, and we were talking earlier about suicide prevention in Montana, especially with the rural community. What can happen out there because nobody has anybody to talk to, or you always had that tough Montana attitude that you didn't need help.
Right.
And a lot of times that can lead to a lot of negative problems that hopefully some of this crisis intervention work that you do can help take care of some of those problems that we have.
Yes, and that's one of the things we hit on too during our training is suicide and asking the question. There's some people out there that believe you can't ask somebody if they're suicidal or if they want to hurt themselves because it might give them the idea. But if they're already thinking about suicide, they already have the idea. So it's a very easy question to ask. You can just it's not an easy question to ask, but the wording could be very easy as, are you suicidal? Do you want to hurt yourself? Those questions can be asked directly. It's not going to make someone more apt to hurt themselves if you ask the question. You're not going to put the idea in their head, and that's one thing we try to push on is you don't have to beat around the bush trying to figure out if somebody's possibly suicidal. Just ask the question. So, and that could be something that anybody could do. If you see a difference in behavior in any of your family members, friends, anything, that question could just be directly answered, asked and answered.
Excellent. Well, Adam, I want to thank you because you are also a member of the board of directors of NAMI here in Billings. And what an organization that is. And we're trying, that's part of the reason we do these programs, is to get the word out that the stigma of mental illness or mental problems we want to deal with and get people to be more open and be able to communicate and know that there are resources out there that can help.
Definitely, and that's one for families that have family members that are in mental health crisis as NAMI. There's a lot of family members that we get that ask, what can I do? NAMI is a great resource to go on and check out their website, call the office. They have a lot of programs to assist families in helping their family member or loved one along in their mental health journey.
Great. Adam Lauwers, thank you for being here today. And again, happy holidays to all you folks out there, that we hope you enjoy the holidays, and we'll see you again with more programs that we'll be doing with NAMI.